Paranoid personality disorder is defined as pervasive, persistent, and inappropriate mistrust of others. Individuals with this disorder are suspicious of others' motives and assume that others intend to exploit, harm, or deceive them. Etiology of paranoid personality disorders could be genetic predisposition or environmental factors like parental antagonism and harassment.
The symptoms of paranoid personality disorder are there is a general distrust and suspicion of others and their motives. These people feel unjustified belief that others are trying to harm or deceive them. They also feel unjustified suspicions of the loyalty and trustworthiness of others. They have a hesitancy to confide in others due to unreasonable fear that others will use the information against them. They perceive innocent remarks or non-threatening situations as personal insults or attacks. They have angry or hostile reactions to perceived slights or insults. They also have a tendency to hold grudges. They have unjustified, recurrent suspicions that their spouse or sexual partner is unfaithful. And the treatments for paranoid personality disorder include psychotherapy, which can be provided in individual sessions, group therapy, or sessions that include family or even friends. And another treatment is medications. There are no medications that are specifically approved by the Food and Drug Administration right now for this disorder. However, there are several types of medications that can help. And those are antidepressants, mood stabilizers, antipsychotic medications, and anti-anxiety medications. And in the severe cases, they're not as common, but in severe cases, a person with this disorder may need hospitalization or to be placed in a residential treatment program. And this is only really recommended if the person is unable to properly care for themselves or they might be in immediate danger.
The next personality disorder we will be discussing is antisocial personality disorder. This is sometimes referred to as sociopathy. This is a mental condition in which a person shows no regard for right and wrong and ignores the rights and feelings of others. They show no guilt or remorse for their behavior. The etiology for this disorder is usually genetic predisposition. It can also come up as a result of environmental influence, such as exposure to violence and abuse, especially in children. There is an increased likelihood of developing antisocial personality disorder in those affected by ADHD and conduct disorder. And studies also show differences in the brain of those affected by antisocial personality disorder, especially in the limbic system, which controls your emotions. Symptoms of antisocial personality disorder include exploitation and manipulation of others for personal gain, a disregard for laws and the rights of others. They tend to lack remorse, as in they don't feel bad for the things that they do to get what they need. And they also tend to be impulsive, reckless, and they fail to plan ahead. Treatment for antisocial personality disorder tends to be lots of therapy, including individual psychotherapy, group therapy, and cognitive behavioral therapy. There aren't necessarily specific medications used to target the symptoms of antisocial personality disorder, but you can use off-label psychopharmacology, such as anxiolytics, antidepressants, and medications used to target the symptoms of aggression.
Dependent personality disorder is a pervasive and excessive need to be taken care of that leads to submissive and clingy behavior, as well as fears of separation. This pattern begins in early adulthood, and is present in a variety of contexts. The etiology is a genetic predisposition raised by authoritarian or overprotective parents, discouraged that discourage independent behaviors. Dependent behaviors are rewarded by the parents. Symptoms: difficulty making everyday decisions, initiating projects, taking responsibility for their actions, tendencies to rely on others, and difficulty maintaining relationships. They are fearful of being alone. They are sensitive to criticism. They go to great lengths to obtain approval and support from others. The treatment for dependent personality disorder is cognitive behavioral therapy, group therapy, and individual psychotherapy to help them develop self-confidence and assertiveness. Another treatment is psychopharmacology, and usually it is antidepressants and anti-anxiety medications.
Obsessive-compulsive personality is a condition of excessive thoughts that lead to repetitive behaviors. Obsessive thoughts include repeated unwanted ideas, fears of contamination, aggressive impulses, persistent sexual thoughts, images of hurting someone you love, thoughts of causing harm to others, and thoughts of being harmed yourself. Compulsive behaviors include constant checking, counting, repetitive cleaning of items, repetitive washing hands, constant checking the stove or locks on the doors, and arranging things in specific places and directions. The etiology of obsessive-compulsive personality disorder is not known, but there are a couple of factors that affect the susceptibility. These are overbearing parenting styles or controls. This often leads to a child having imposed standards of behavior that are condemned if not met. This can lead to excessive thoughts and concerns about what not to do and how to avoid punishment. Also, stressful life events and genetic and family history also contribute to OCD. In children, the population of OCD is greater in males, which then is reversed in adulthood, where females have a greater affected population of OCD.
Some of the symptoms of obsessive-compulsive personality disorder are the person might be extra polite and formal. They might have difficulty expressing emotions. They may be over-disciplined, perfectionistic, and preoccupied with rules. They can be very inflexible. They can be devoted to productivity with little concern for extracurricular activities. They may have fear of making mistakes, which may lead to difficulty making decisions. And they definitely lack spontaneity. Some of the treatments for OCD are drug therapy. There's two types of antidepressants they use. The first is the SSRIs. With those, the side effects are sleep disturbance, headaches, and restlessness. The other type of antidepressant are the tricyclics. And with those, the side effects come blurred vision, sweatiness, drowsiness, racing heart, weight gain, urinary retention, and low sex drive. The preferred psychotherapy used to treat OCD is exposure and response prevention, or ERP. This is where the rituals will be prevented and the OCD patient is gradually exposed to feared thoughts or situations. As a last-ditch effort, a neurosurgery can be performed, and it's done by making a lesion in the cingulate bundle in the white matter of the brain.
Narcissistic personality disorder. Definition. It's a mental condition in which people have an inflated sense of their own importance, a deep need for excessive attention and admiration, troubled relationships, and lack of empathy for others. But behind this mask of extreme confidence lies a fragile self-esteem that's vulnerable to the slightest criticism.
The etiology of narcissistic personality disorder is unknown, but there are theories about environmental, genetic, and neurobiologic factors that could contribute. Some of the symptoms of narcissistic personality disorder are that patients will have an exaggerated sense of self-importance, have a sense of entitlement, and require constant excessive admiration, expect to be recognized as superior even without achievements that warrant it, exaggerate achievements and talents, monopolize conversations, and belittle or look down on people they perceive as inferior, take advantage of others to get what they want, be envious of others and believe others envy them, trouble handling criticism, become impatient or angry when they don't receive special treatment, have difficulty regulating emotions and behaviors, and they can have secret feelings of insecurity, shame, vulnerability, and humiliation. Some of the treatments for narcissistic personality disorder are psychotherapy or talk therapy, where they would learn to relate better with others so their relationships are more intimate, enjoyable, and rewarding. There are no medications specifically used to treat narcissistic personality disorder. However, if you have symptoms of depression, anxiety, or other conditions, medications like antidepressants or anti-anxiety drugs might be helpful.